My widest separation was 4.5 fingers, and she was encouraged before to have surgery, was basically told that there was nothing she could do outside of surgery to close. She told me that, and she's like, I already know I probably will need surgery, but I would just like to have another opinion. And I have a whole opinion on surgery. and so we got to have a very honest discussion, and she trusted me, and I told her a lot of things we could do to support the healing, to get as much out of it as possible. And she needed a lot more sessions, and she was at 4.5 fingers, but she is already under 2 fingers.
I'm Garrett Salpeter, and I believe that the most powerful and transformative way to help people recover from pain and injury, heal from trauma, and reach their highest levels of fitness and performance is to focus on the nervous system. In this podcast, we'll share knowledge from the frontiers of neuroscience and inspirational stories of how applying that knowledge has empowered people from all walks of life to heal, adapt, and grow. Hello, NeuFit Nation, and welcome back to the Undercurrent podcast. I have 2 special guests today. One is Dr. Lauren Adamski, and the other is Anna Bales, both from Bump and Beyond Chiropractic. They're here in the Austin area, and they do a lot of work with moms-to-be during pregnancy, with new moms, helping them recover after giving birth, and even with their babies too. They're doing pioneering work, especially in the area of diastasis recti or diastasis. We may go back and forth in how we say that term, but we'll of course dive into today what that is and how they're treating it. Lauren is the chiropractor, Anna is the exercise physiologist, and so they have a really awesome team approach and perspective here. And Dr. Lauren and Anna, welcome.
Thank you so much for having us. We're so excited to be here.
Yes, thanks so much.
Awesome. Well, can you, just to help people understand sort of your background and the origin story of Bump and Beyond, can you, perhaps Lauren first and then Anna, let us know how you got to be here today, how you got to starting the practice and focusing specifically on this sort of niche of pregnant women and new moms after birth?
Yeah, absolutely. So we started off a little bit uniquely. So I started off doing concierge chiropractic. And so I did home visits. I traveled to people's homes to see them for whatever kind of issues that they were having. And then Anna joined me about 8 months later once we were able to actually get the physical location. And so it was super nice. It's the 2 of us, and we also have a massage therapist on staff as well. So we add and incorporate a little bit of massage. But yeah, it's been super lovely to be able to kind of incorporate both chiropractic and what Anna's doing with exercise physiology as well.
And when you before we move on to Anna for her turn to share, did you all along want to focus on pregnant, expecting mothers and new moms, or is that something that sort of evolved as a niche focus, or how did you choose that?
Yeah, absolutely. So I actually started off in chiro school thinking I wanted to do more exercise and sports chiropractic. And so I chose a school specifically that had a sports master's program that I could do at the same time. But while I was working in the campus clinic, I had a couple pregnant patients, and I absolutely loved working with them. It was so satisfying to be able to help them throughout their pregnancy. It was really rewarding. And then getting to meet baby after, I absolutely fell in love with it. And that kind of shifted the trajectory of my plans. So instead of doing that sports master's, I actually ended up doing an additional certification through the ICPA. It's called the CACCP. It's an extra year-long certification that allows me to work with both moms and babies, and just gives me all that kind of extra knowledge to work with those populations.
Awesome. Thank you for that. And now, Anna, your turn. How did you, similar question, how did you get interested in working with this particular population and join up with Lauren?
Yeah, so I started in school thinking I was going to be a midwife or OBGYN. I was always wanting to go the medical route with women's health. And while I was in school, I did a whole switch around and went into exercise physiology. It was actually, that's a whole other story, but it was going to be a long roundabout way to go back to it because I just wanted to have more of a wellness, full body approach. And then I ended up falling in love with that, but got really frustrated in exercise physiology classes and my personal training certifications because it was like a blip of information for pregnant clients or postpartum clients. Like it was like for pregnancy, hey, make sure you don't put them on their bellies. And there was nothing written about postpartum clients. And so I started to get really frustrated and started doing a lot more of my own research on wanting to help more of this group of people that I felt like were getting really looked over in the health and fitness industry. Fell in love with a lot of Instagram people that were doing more of the work of educating on diastasis. And that was what I fell in love with. And then Lauren and I met, and we knew we would be a great team, and our passions were directly in line. And so we started this, and it's been really, really awesome to have the power team of realigning and helping your optimal wellness with your chiropractic adjustments. And we do say here that we have the trifecta, right? You have strengthening, you have lengthening, and you have the whole alignment kind of all in the same practice, the trifecta. And it really has, when you can invest in your health in that full trifecta, you really see some amazing results. But with what I do with diastasis, it's been really cool to see the progress that a lot of the clients have made in such a short amount of time.
That's awesome. And we definitely will talk about that in detail. I'm interested in hearing a lot more about that. One thing that you said that really jumps out at me, though, is you were talking about going through this exercise physiology education, and the work on pregnant women was just a little blip, and there was very little information on it. And I think a lot of people listening to this too, well, even just my personal experience, I am the father of 2 children. So when my wife was pregnant, it was difficult to find some information, and there's a lot of in some ways it's almost treated as if pregnancy is a disease, and it's like, oh no, you shouldn't exercise. And we actually, you mentioned you were interested in midwifery. She gave birth twice with a midwife at a birthing center, and we actually found ways to use exercise as a tool to prepare her for the rigors of natural childbirth, right? And so I think there's this whole interesting paradigm shift. And a lot of people listening to this may not know, the extent of work that can be done with pregnant, expecting mothers, with new moms. So can you, before we dive into the diastasis, can you give us a sense of the types of services that you offer, for, just so everyone listening in chiropractic, physical therapy, related professions can understand, like, what work can you do and will you do with a pregnant mom leading up to birth? And then what other services can you offer afterwards? Obviously, there's that theme of the trifecta: you're lengthening and strengthening and aligning, right? All that. But can you just give us a sense of, what services you do offer?
Yeah, we do a lot in the office, obviously. First is, I would say the first thing, other than doing a whole assessment with Dr. Lauren for like pain and issues that are happening during pregnancy, she also checks for diastasis while they're pregnant, because every woman will get diastasis. So it's just kind of seeing at what point it shows up and how wide it separates during pregnancy. We give exercises for them to do, but we definitely do more of also an assessment for their goals, because for a lot of people, they're told, like you said, it's kind of addressed as a disease. Oh no, you're pregnant, don't do anything, you're gonna hurt the baby. But bodies are super resilient, and our bodies were designed to be able to be pregnant and to carry a baby. And it's very protected, and you can still continue to do a lot of activities. So I do personal training as well for pregnant women in the office, and but I also just help support a lot of what they currently are doing. Because one of the things that you can definitely do is whatever you're doing before, you can generally continue through pregnancy up to a point, to a certain intensity. So we encourage and want to support whatever activities they are already currently doing. And then through that, it's a conversation of how's your body feeling. If you've had any other issues, it obviously arises kind of when we might dial back on some of the intensity or maybe some of the activities. But for the most part, most women can go up to birth for a lot of the activities they're doing. Again, there's always situations, but for the majority of women who are physically active before, pregnancy is not a contraindication for a lot of other activities. And then with Lauren, I mean, she can speak to that as well. We do a lot to support the body's as it's growing and changing, to continue to support that, if you want to speak to that.
Absolutely. I'll just start with saying my pregnant women that are active, that go on walks, that do a little bit of weightlifting, things like that, they actually have a lot less pain, just because they are moving. They're not just sitting in kind of weird positions kind of throughout the day. But in our initial visit, I like to start them with just some light exercise of kind of that diaphragm breathing, really get them kind of connected to their core. And then as we go and we build, I add in core exercises to help keep their posture in that correct posture, because a lot of pregnant women actually tend to walk with that lordotic curve, and that can kind of weaken their core. It can advance their separation there, along with causing a lot of the issues that you see in pregnancy, that low back pain, that SI pain, sciatica, kind of hip issues, even going into that kind of like pelvic floor pubic bone pain. So just by kind of adjusting the posture and giving even baby a little bit more space, we can help them not only get out of pain, but also feel much stronger in their core, prevent that diastasis from getting worse, and make it so much easier to rehab once they give birth. And then in our office with other exercises, we also do spinning babies exercises. So if they do have a breech baby, we also give exercises to encourage baby to then go head down.
That's, you said spinning baby, like getting the baby to turn, right? Okay.
Yep. So Spinning Babies is its own company. They have a website. You can look at them, and they have such amazing knowledge. You can also be Spinning Baby certified. So it is kind of a brand name. But we do it in the office, those specific exercises. They use gravity in order to encourage baby to go head down.
When you said that at first, I was thinking of having like these on a merry-go-round or something, right? So, okay. And then, one question people may have, are you actually doing chiropractic adjustments? And if so, are you having women, lying prone on those wedges where there's room for the expanding belly and the baby, and what, just practically, what is that like?
So, all of my appointments include chiropractic adjustments. They include some soft tissue work, some cupping, along with exercises for whatever issue they're coming in for, or if they're feeling pretty good, we just work on core stuff. Our table is a special table that actually has a belly drop away, so they can lay face down, and it has room for their belly. Which is super nice. All our women love to be able to go face down because they can't normally do that. And yeah, so I'll adjust their full spine. I'll do some cupping, some soft tissue. We can even do some stuff to help specific issues. So around ligament massage, help that feel better. Different things soft tissue wise to help with sciatica, some different exercises. So a lot of really good adjustments specifically for pregnancy.
Yeah, and so does our massage table. Also has a belly drop cutout with a supported netting so that women can also go face down for their massages and not have to be on like all the wedges and all of the things that make them feel. It definitely makes you feel a little bit more normal and allows your low back to kind of ease. And so they really enjoy it. Sometimes they're just like, can I just come here and lay down? Because the support is so nice for, and it also helps alleviate as well for a lot of moms after who are breastfeeding and might be still a little bit more engorged with their chest. It also alleviates tension for there too. So we definitely are very focused to assisting wherever you're at, and making sure that what we're doing is supporting your body and how it feels.
That's awesome. I remember when my girls were in the womb and with my wife, we did have one of those like wedge pillows and stuff. So this sounds like this is even better.
Yeah.
I wish you'd been around back then. But.
Yeah. Step up for sure. Yeah.
We have those pillows too. I do have a portable table, so I know exactly what you're talking about. So for my moms who want home visits only, I use those, and they're still great and wonderful, but they especially love the belly drop away table.
Nice. All right. So we've mentioned now a few times diastasis or diastasis. I'll oscillate back and forth.
I do too.
Try to respect everyone in their preferred way.
If you'd like.
DR. That's good. There we go. I like that. That's a nice way around it altogether.
There you go.
So DR, diastasis recti. So you've mentioned it a few times. You mentioned, Lauren, that it develops during pregnancy, and then Anna talked about addressing it in rehab. So it's everyone listening to this, I imagine, is familiar with it. But if just in case they aren't, can you give us the textbook definition and talk about how you measure it and that stuff?
Sure. So DR, diastasis recti, is the separation of the rectus abdominis muscles due to a relaxed position of the linea alba, which is the tendon that runs through all of those abdominal tissues from, because there's multiple layers, but for your six-pack muscles or your rectus abdominis all the way back through transverse oblique muscles, all of the tendons kind of overstretch. We do know it happens during pregnancy, but there's other ways you can also get DR. So I have seen men as well. And I've had it. I haven't had children, but I had it from having celiac disease. Essentially, what can happen is the pressure from the abdominal cavity behind is putting strain on the tendon. And so over time, it continues to pull and separate. So for pregnant women, it's obviously because baby is growing behind and putting pressure and pushing on the muscles to separate. And it's useful in pregnancy because then when you're pushing with your abdominals, you're using all of that surface area in order to push baby out. Sometimes, depending on the aggression of the contractions or the pushing, it can pull and actually strain the tendon versus it just being elongated. For men and other individuals that I've also seen for DR, you can get it from improper movements for exercise. So doing core exercises incorrectly, especially breathing incorrectly while doing core exercises, you build your own intra-abdominal pressure. And so you could cause kind of separation there. And I've also seen it for people who have either gained a lot of weight really fast or lost a lot of weight really fast. Again, just because of the pressure that's placed on the tendon can cause it to pull and elongate. So it's most commonly measured by being laying down in a prone position and kind of crunching your head and shoulders up, and then feeling with your fingers starting kind of underneath your rib cage and following down just straight down through from the belly button down to where your pelvis kind of is positioned there. You can feel the separation. I check it that way, as well as I like to feel for the resistance of the tendon. So I can normally tell based on just palpation if it's solely separation or if it's also a lack of tendon resistance, which normally means that the client will need more sessions for the tendon itself to heal, not just reposition back the muscles. So there's kind of different ways to check for diastasis in that way, and that's how we do it at the office here. Lauren will check during pregnancy and see how it's progressing, and then we can check right after, depending on how early they want to come in. And then at 6 weeks post baby, we'll encourage them to be checked by their OBGYN first and be cleared by a doctor just to do the program. And then they'll normally come in and I'll do a full assessment and also check for muscle compensations for that as well. So that's kind of the long-winded version of what DR is.
I'm going to add on a little bit. So I also see kids occasionally who have diastasis as well. So all babies are actually born with diastasis. And so if they skip some of those milestones, such as crawling, tummy time, things like that, that really build that core strength, the diastasis can never fully close and heal. And so they've had diastasis all their life. And that leads to kids with some low back pain, some balance issues, coordination, where they just don't have that kind of core control. So we do also do core exercises and things like that with kids as well. And then same with our teenage athletes, gymnasts, especially, and cheerleaders, where they're having that kind of repetitive motion against the ground on that pelvic floor. It can cause some of that separation as well.
Okay, that's good. Good to know. It's not just pregnant or women or those who have recently given birth. That's that's interesting there. And so in terms of the, obviously, you know, women and and sometimes, young children or teenagers are coming in to address this, men too. So they're coming to do it. And the reason they're addressing it, it's not just cosmetic. It's functional too, right? The separation does affect. Can you describe a little more about, how it affects movement and function and the neuromuscular system overall?
Yeah, I mean, we say your core, and I think, not to be simple about it, but your core is the foundation for a lot within your physiology. So some of the biggest symptoms we'll see coming in is low back pain is probably one of the largest, and that's postural, but it's hard to hold your posture correctly when your core is not holding basically 65% of your body weight correctly. Um, we have hip flexors, really, really tight hip flexors. So we'll see some hip pain as well. And again, that's positional because pelvis, we have anterior pelvic tilt. So because it's pointed more forward, the hip flexors tighten up. I'll even see symptoms for knee pain, upper back tightness. So you have lower cross syndrome, upper cross syndrome can sometimes give us a sign that there's an issue with their core. We'll see breathing being inefficient. So a lot of the first sessions of our program specifically are designed to help with breath work and diaphragmatic breathing, proper 360 breathing and brace breathing, to make sure that functionally we're taking in the oxygen we need for our cellular processes, but also just how we're breathing and what muscles we're using to breathe can affect a lot of kind of systematic pain referred to places. So when we can work on that, we can fix a lot of the other issues. There might be saying pelvic floor dysfunction. So I'll see a lot of people with leaking or incontinence. We're not a pelvic floor specific treatment. However, I haven't seen anybody not benefit in their pelvic floor from doing the program because your core being a pressure-based support system, it does help affect and benefit your pelvic floor. So I always see that as a result as well. Though I don't do specific pelvic floor internal work, it is all together. It works all together. So we benefit from that as well. Even neck pain, we see improve from helping with core. I mean, you think your body works from the ground up. So even how you walk, how you sit, how you stand, it's all supported from the ground up. So as you work on your posture with your hips and your core, you build the structure for your ribs and your shoulders and your neck and your head. Everything just kind of builds all the way up. So the more that we can engage and support with our core, the better everything else kind of moves with our torso and then supports everything else moving as well. Those are everything off the top of my head. Do you have anything to add?
Yeah, some pregnancy specific things that I see with diastasis are also some of that kind of sciatica, hip pain as well. But mostly, I think the biggest red flags are the low back pain and kind of those pelvic floor issues.
Yeah.
Good. I think that was a very good, thorough description. So thank you both for that. And now I imagine everyone listening is wondering the same thing I am, which is, okay, so what is the program and how do you address this? And, kind of fill us in on your approach, please.
Yeah, so the CoreFit program is my baby. It's really awesome because I design it a little differently depending on the diastasis that I'm seeing for each patient. So diastasis can look a little different. Some people have more upper diastasis, some have it right at their navel, some have it lower, and that'll modify the program ever so slightly because if it's upper, we're going to work more on your rib cage and your upper body position. And if it's lower, we're going to work more on your pelvis and your hips. So it's a little bit different. And that's why the consultation is really important because I go through, one, what your physical goals are. Because I want to know, are you just somebody who wants to walk, be fit and healthy, or are you a CrossFitter, or are you doing crazy things like I have I have one girl who's like a professional rugby player. So I want to know what your goals are, because I can help tailor the program, obviously, to make sure you're getting the most out of the process. Now, in the consult, I'm checking for your muscle imbalances and seeing kind of where your tighter muscles are, positionally supporting you, all of that. Now, I do the packaging of the program specific to what your diastasis is. So somebody with a 1.5 finger separation doesn't need to have 20 sessions with me. Those who have a 4.5 finger separation are going to need more sessions. So I package the program specifically for how extensive your diastasis is. And so that's why the consult is important, for us to visualize kind of what's all going on in your body, so we can make sure that the program is what's most beneficial for you. Then the program itself is a protocol that's very minor at first. I say it's kind of similar to just being in a PT program, where we're working very small movements in conjunction with your breath. The program specifically is on average twice a week for an hour. You're on the newbie machine for about 40 minutes, and we go through some exercises. I say it's about 3 circuits of 3 different exercises that we're moving through with quality. So it's not certain rep counts as much as we want the movements to be as effective as possible. And then we progress as those movements become more natural, and I see that you're using them and doing them well. And as well as people doing their homework, we can progress a little faster. So on average, I would say a package for 2 finger separation, which is the most average diastasis measurement that I see, is about 10 sessions. I usually see a full finger of closure within 4 sessions. So on their 4th visit, when they come in, so actually 3, because it's before we even do anything, on their 4th session, I will remeasure, and I usually check every 4 sessions to make sure we're progressing well. You don't want to check too often, or it's like kind of checking the mirror when you're like trying to lose weight. You don't really see as much change, but if you have a little bit of time in between, you can see more of a difference. And so I check about every 4 sessions, almost to a T. On the 4th, I've never seen less than a half a finger of closure. On average, I see a full finger of closure. The newbie machine, because it is contracting the muscles, and they want to contract in a straight line, because that's what your rectus abdominis, rectus means straight. So they want to contract in a straight line. Being on the newbie machine puts them in an optimal position. The tendon is what takes longer to heal, and that's what's structurally going to hold and sustain the closure. So that's why, even though some of my people at 2 fingers might already be at 1 finger at their 4th session, but I will be checking to see how the tendon is also healing, and it usually takes a few more sessions in that optimal position to support the tendon coming behind and structurally holding where that closure has happened. And that's different. After that, it kind of varies. Nutrition plays a huge part into how well your tendon heals. How much you're doing to support your body outside of the program can help benefit a quicker closure and support of the closure. So my widest separation to this point was 4.5 fingers, and she was encouraged before to have surgery, was basically told that there was nothing she could do outside of surgery to close. Came in to see us, and she told me that, and she's like, I already know I probably will need surgery, but I would just like to have another opinion. And I have a whole opinion on surgery. And so we got to have a very honest discussion, and she trusted me, and I told her a lot of things we could do to support the healing, to get as much out of it as possible. And she needed a lot more sessions, and she was at 4.5 fingers, but she is already under 2 fingers. We are still supporting the tendon, as it's gone from a very wide gap to under 2 fingers. We still need the tendon to support and heal, but it is. We only have a very small area left that the tendon has not supported yet. So that's been my biggest success story at this point. but it is very effective as a program. And that's one thing that we love being able to encourage. Even people who I've had come in do only 4 sessions because that's all they could afford, have seen incredible results and then come in whenever they can just to get a little bit more support for their core to allow diastasis to close. So yeah, that's a snippet of the CoreFit program.
Thank you so much for listening to the Undercurrent podcast. If you're interested in learning more about how NeuFit and the newbie can impact your life, please visit our website at www.neu.fit. That's NEU.fit. So you can learn more about how it might integrate into your professional practice, how you can use it as a patient, and you can also connect with our team there. That's awesome. And I like that even in your description of DR and then now in the treatment that you make the distinction between just the muscle tissue and the tendon needing to heal and how that can be different timescales. And, pardon the pun, but I had a surface level understanding just thinking about the gap in the muscles and not necessarily, right, the way that you described you were feeling for the integrity of the tendon as well. I think that is one of my big takeaways in growth and understanding here too. So I appreciate that. In terms of getting the tendon to heal, to get more integrity, to shorten and all that, is there any it's connective tissue and it responds to the lengths in which it's used. So if you do an exercise in there for an hour, but then the other 23 hours of the day, it's stretching back out. Is there anything that you need to do to encourage it to close and stay more taut and shorter in length in that interim period? Or what's your thought process specifically on that, addressing the tendon?
Yeah, so we definitely don't encourage like belly binding or corsets or anything like that, which I do get that question quite a bit from a lot of women who want to use a corset training. Now although I will say for the tendon, I wouldn't say that that's not a good idea, but when it comes to corset and belly binding, you actually weaken and create an atrophy in the muscles. So then we're kind of going back and forth between muscle tendon. So we don't encourage anything like that. We do use KT tape. So if I have some with more severe lack of tendon resistance, I do use KT tape and we can help support the process there. Since I see twice a week, I don't usually put KT tape on at the beginning of the week since we're going to continue to put the newbie electrodes there. So I use them kind of on the weekends, or if we're increasing or bringing back another activity. So I do ask for no running, and I have kind of some things that we dial back on with activity because it can, we're unlearning some movement patterns. And so we don't want to bring back in a lot of the stressors that can cause us to go back to some compensations. So I do ask I have a lot of runners, and most women after having a baby, when they want to lose the baby weight, they immediately go to running and ab exercises that are all specifically not good movements for your core and for pelvic floor, especially after having a baby. But it's also, some of them it's their mental exercise. Like they like to go on a run because that's what helps keep them sane. So when we're going to increase in activities and we're at a point where we can start bringing more activity back in as we're continuing through the program, I will KT tape, and we can KT tape in such a way that we can support the tendon being in a better position, holding those muscles a little bit better to support healing when not on the machine. But I don't see it a lot to say that, oh, as soon as you're gone here, once you leave here, you're not benefiting. I see a lot of people after being on the newbie machine leaving and continuing to feel the benefits, even not being here. So I tell people all the time, even if you can come in and be on the machine one time, we can re-educate the muscles to be active more than they were. And even if that's 8% more activation, that's 8% more motor units that we're communicating with and building muscle tone. And that will continue to improve. And for most women, that I see, they would describe their abdomen as like a galaxy of space that they can't find to contract properly. Like if we say, hey, do a sit-up, how? They'll just look at me with wide eyes laying on the ground and literally be like, how do I do that? So to be able to just give the sensation of where the muscles are and helping the nervous tissue kind of find those muscles again, they benefit. So, and then I give homework. So on the days that they're not with me, they have homework to do that are doing a lot of the same movements they just did with me on the machine to help them and their own ability to contract those muscles without being on the newbie machine. And then, of course, I do encourage nutrition and kind of supplementation in order to help support the tendons integrity as well.
I think building off of that, Anna builds such a good foundation in those first few visits with her clients to really strengthen and support that posture, that the tendon is still in that kind of correct position as they do things throughout the rest of the day. And then one caveat that you were talking about earlier with the binding is I actually do recommend binding in that initial postpartum period. So during those first 6 weeks, a belly binder can be helpful as long as they're using it in a non-active way. So while they're kind of resting, laying down or sitting just a little bit supported, they can have that belly binder to help approximate and bring those muscles closer together to start that healing process. I just don't like them wearing it when they're up and moving, because then they start relying on that belly binder instead of actually using those muscles themselves.
Yeah, it's so true. I do have some people I encourage, some of my widest separations, to use it when they're breastfeeding because of the really relaxed position, and you're normally just holding baby in a not a great postural position normally. So I do encourage in those moments, if it is more severe, to hold. So yeah, you're right. Good correction.
Yeah. And I like that. I like that too. When they're not wearing it during exercise, so they're learning to not relying on it as a crutch, learning to use their muscles again, but at other times using it for some support. So I think that sounds like an excellent way to balance all those different variables there. One thing that you said, Anna, that I wanted to touch on, you mentioned that, um, women will often do core exercises that, can be harmful. So I imagine you're talking about like crunches or planks where there's pressure forward, which could cause greater separation. I mean, can you talk a little more about that and sort of what your advice is there to do and not do, in terms of exercises generally?
Yeah, for sure. So that is one of my biggest things that I see are planks, sit-ups, crunches, bicycle abs, Russian twists. And exactly like you were saying, it's for most women postpartum, body position has changed. And so even if they were if they've done them before, going immediately back to those movements, the muscles themselves are not in optimal alignment. So as they're even if they were gymnasts and doing stuff, going back to those movements directly, usually body position is not, or posture for those movements is not in a good position. That pushes your breath to breathe differently. And most women postpartum still breathe more up into their chest and shoulders versus using diaphragmatic breathing and using their core. And when doing that, we are once again building intra-abdominal pressure during the movements and causing more separation. So those are movements that we don't encourage. Immediately we encourage just doing some pelvic tucks. So you can use a wall, you can lay on your back on the ground. I start off usually with having patients on the ground, their feet raised, either on like a couch or a bench. That way we're taking a little bit of gravity away from it as well, and working on pelvic tucks with their breath, just moving to gain really small, minor contractions for their core, and also helping to support pelvic floor with their diaphragmatic breathing. Then some of the more easier or the more simple movements like bird dogs, but we keep feet or toes on the ground. So as we're sliding out, we're not lifting our feet when we're extending back, mostly because when most women that I see, when they're attempting to do so, they untuck their core. When they do lift their foot, their pelvis will drop forward, and so their core will disengage. So there's a lot of simple modifications for that. Bridges are a good movement that we start with, making sure that they're starting tucked, exhaling as they're lifting their hips, and then kind of slowly bringing their low back down to touch before their glutes. Clamshells, a lot of really safe, small movements that you can feel in your core when you're doing them correctly. I just think most women immediately want to bust out some 100 sit-ups, and it's not the most effective, and it's also not the most optimal for their body directly after. Now, I'm not somebody who's like, I never want to see you do that again. I have heard that multiple times, and I just think that that's impractical. And I also don't think that that's useful. I'm not a never person. I'm a not now person. So if that's something you want to do, let's build your body to be strong enough to get back to do that movement where it's safe to do it. Like, I have some who want to do hollow holds, but hollow holds are a really challenging movement for your core. And almost immediately everyone will cone or dome, which is where it'll appear to have kind of like a tunnel of skin or just pressure kind of coming forward right through that center line. It almost literally looks like a groundhog went right across your abdomen, and you get like this tunnel of skin. And if you see that, that's one of those where I tell people, if you see coning or doming, you immediately stop the movement, because your body is not prepared to do that movement. It'll either be one of three things. Either your position is not correct, so you've lost your core engagement. Your breath is not correct, so you're holding more intra-abdominal pressure and it's causing the coning and doming. Or your connective tissue and your muscles are not prepared for you to do that movement. So I tell people, especially when they're done with the program, who want to go and join gyms and do group fitness and all of that, which I love, and I want everyone to go be fit and be healthy. Those are your checks. If you're seeing coning and doming, 1, first check your position. 2, check your breath. And if you've made those 2 adjustments and you're still seeing it, then that movement you're not prepared for it yet. So modify down.
I think that's a beautiful guideline. I mean, yes, we don't necessarily want to tell anyone you can't do this ever again, right? We're not trying to play God. But we do need to educate them that if you want to do this movement, you just have to be prepared. You have to be able to hold the position, breathe appropriately, have the tissues prepared and strong enough. So I love how you went through those 3 there. And then when you're talking about doing, just to sort of circle back to some of your program, you talked about, starting with pelvic tucks, breathing, bird dogs, some, glute bridge type exercises. So are those also, when you talk about having sets of movements you're going through with the New Beyond, are those some of the movements that you're using in that program?
Exactly. Yeah. And we're building. That's why I ask a lot of questions at the beginning, because I will modify some of the movements through the program kind of towards the end to structure them more to what they're going to replicate in their day-to-day. So for some people, I'm replicating just daily activity movements like picking up a laundry basket or carrying grocery bags or carrying their kids on their hips, or daily activities. Or I have people who have other goals that I want to replicate those movements in support for their body. So it is a protocol that increases in intensity. So it starts off really, really small, kind of building the foundation up. And then by the end of the program, we're doing things like cleans and dumbbell cleans, or single side marches with a heavy weight, or we're doing planks. They might be doing sit-ups. They might be doing hollow holds. We're doing a lot more challenging core exercises, because that's daily life. A lot of those movements are things we do every day. So we're definitely working to build functional strength and useful strength as we go through the program too.
I love that progression. And just to clarify, hollow holds, that's where you're lying supine, right? So you're on your back and you have your arms up. You kind of lift your arms and your legs up just a little bit. Okay, yeah.
Yes. Yeah, it's a challenging one. Normally, people's low backs will lift off the ground. And once your low back is off the ground, I mean, 98% of people, when their low back lifts off the ground, your core is no longer engaged positionally. Now, I don't want to say that as an overall statement, because I have seen some really crazy fit people who have not had core issues and their low back can lift, but general population, and I'd say for almost everyone, if your low back is not engaged into the ground and you're not tucking ever so slightly, you're getting less of a core engagement than you should be.
Yeah, good cue, good tip to look out for. I wholeheartedly agree. In terms of, so that's some great insights into the exercise selection and the progressions. Can you talk a little bit about, many people listening to this have a newbie in their clinic, so they might be curious around, like, do you have favorite pad placements? Are you mapping, or do you sort of have predetermined places? Because obviously you're going to be working with the abdominal wall. What are you thinking in terms of, are you using more of the, like you talked about, the triad, lengthening and strengthening alignment? Of course, for those of you who use the newbie, there's frequencies that can create more contraction or more relaxation, lengthening and activation and input and things like that. So can you just share a little bit about your approach, and sort of how you're thinking about applying the newbie as part of this program?
Yeah, for sure. So we use channels 1 and 2, and I do change it a lot for different people, but general protocol for me is I have 2 pads above the navel and 2 pads below the navel. I sync left together and right together, so I have red on top, black on the bottom. So we're doing bilateral. Usually I'm starting at 500 frequency, and I build to an intensity. I say I start everybody at 20, but we go up to an intensity that you can breathe and move through, because as we know, it does contract you. And if you're contracted to the point that you can't move through it, we're not building the way that we want to build the movement. And so that varies for everybody. So intensity kind of varies, but my frequency, I always start at 500. At their 4th session, if I'm seeing closure, which I usually am, I don't think I've ever not actually, I will start to decrease the frequency and go deeper. So as we progress through, I start to deepen, and every other session, I probably move the frequency just a little bit more, again, depending on what I'm seeing, and how they're moving. And then sometimes we'll cross the pad position. So instead of being bilateral, then we'll cross over the navel, especially if I'm seeing less tendon healing right at the navel. For those that are still struggling with transverse ab activation, then I'll do on either side of the navel, and then even wider on the outside of their obliques, and grabbing more of their transverse abs. Sometimes I have people who are having really bad low back pain, so then I'll actually put the pads on their low back on a lower, middle frequency, so like 100 and 160, and we'll do more stretches. And we do the same for hip flexors, because hip flexors as well are one of those. Hip flexors and low back, about 5 sessions in, when your body position starts changing with your core being more taut, they kind of fight back a little bit. So we might focus a little bit more on stretching for low back and hip flexors if that's starting to come up. But I pretty much keep the pads on just rectus abdominis, transverse, and obliques. And that is our major focus. I have a couple people who positionally will have no glute activation when we're doing exercises, which another thing is that your core and your glutes are directly related. So I might put the pads on their glutes to do more glute exercises to support more glute activation. Some I've done at the same time. But that kind of varies person to person with what they're seeing. I'd say majority of the time for the program, specifically doing the program, we're staying on the abdomen, unless I have other information and other things we're working on as well.
And one other thing to add is we actually use the circle pads instead of the long rectangular pads. I think we've tried and played with those in the past, but have found the best results with the circular pads, especially in the abdomen.
Especially in the abdomen. And because it is a full exercise program as well, the pads don't stay. So we also do use bands to hold the pads in place while we're doing a lot of the core exercises. People get sweaty and they will start to slide, and that causes some discomfort. So we use some bands to hold the pads on the locations we want them on, and that also has helped us get more activation there too.
That's awesome. Thank you so much for sharing that. And I can't help but smile because this is one of the things that I've loved most about seeing, this work evolve, and the newbie being out there for, at the time of this recording, over 7 years, is seeing people like you that are taking this technology and this work and working with different people, certainly in different geographic areas, but different populations that, I certainly wasn't focusing on or wasn't really able to help. And, to be able to learn from you and hear the experiences that you're having it's just so wonderful and exciting and humbling and gratifying. And I thank you for sharing this. I really, really love to hear it. And I know there's a lot of people listening who are, going to benefit from this and be able to use their newbies to help people, in their region or country or, wherever they're listening in from. So I really appreciate you sharing all of that. That's wonderful.
Yeah.
And one thing for other providers that are listening, we are actually in the works of putting together kind of a full kind of program that has videos and different things that you can actually look at and have like a set guideline of what to do, what exercises, what progressions, and all of that going forward. And you can find that just through our website, hopefully soon.
It's a lot of work to do online programs.
Yep.
Oh yes, for sure. And I think, I don't know if I know. So Ramona is the PhD neuroscientist on our team, who's our VP of Research and Clinical Affairs. I think she had mentioned talking to you about collaborating to
Yes.
do some, NeuFit specific, specifically incorporating the newbie education. So that's something that, when that's available, we certainly will share with everybody, because that's something that just can benefit so many people. And it is an area where, like we talked about on the front end of this conversation, where there isn't much. This, pregnancy is sort of thought of like as an afterthought, and not really not enough people focusing on it. And there's a lot of women who are just really left behind.
Yeah.
So to have solutions and have answers like this is something that I'm really excited about, and so grateful that you're doing this work and that we'll have an opportunity to share it together.
Yeah, I think that's one thing for us that we find super rewarding. It's rough because a lot of the women coming in that have separation and are dealing with all of these issues are basically told surgery is the only option. And having surgery means you can't pick up anything over 8 pounds for 6 weeks. And they just had a baby that's probably about 8 pounds and a car seat and a stroller and all these things. So you're like, surgery is not your best option for a lot of reasons. But the frustrating thing is that even programs that we have, they're cash based because insurance won't cover, DR recovery because it's considered cosmetic. And so that's something that I think we are trying to battle just a little bit as well, because we believe that it's so functional and that it's so necessary. And it really is your foundation for all the other movements that you're doing and trying to eliminate issues. My oldest client has been 71. And she had 3-finger separation when she started, and she closed doing the program. So we have a lot of women, my mom included, who has 3-finger separation, and we both work with our moms to when they're in town. So it's more limited, but whenever they're here, we're like, you're doing the program, because there's so many women for so long that we're just basically told, oh, you had a baby. This is life now. And instead of supporting and helping, yes, there's a new normal, but it's not the normal that's being accepted. And there's a lot of things that can be healed. And we just love that we get to be a part of a lot of people who are like waking up to that, to be like, oh, I shouldn't accept the fact that I pee when I sneeze, cough, or laugh. That's not normal. And it's not just because you had 3 kids. Like, you can heal those structures to not deal with that constantly. And we just love that we get to kind of pioneer that education and help support and see such amazing results, both like subjectively in people's lives, but also in their physiology.
Absolutely.
Yeah. I can't help but, first of all, beautifully said. I wholeheartedly agree. Second of all, I can't help but call out the just the what you said there about insurance wouldn't pay for these treatments, and yet they would pay for someone to get surgery, right? After DR,
Right.
right? It's like there's a lot of work to be done,
Right.
systemically to make some change here. But you two are on the leading edge of that, and at least making a big impact locally that I'm optimistic can spread even beyond our metropolitan area here. So
That would be
as
amazing.
we yes as we wind down the conversation, shifting gears, is there anything to say or share? I know Dr. Lauren, you've got a martial arts background. Anna, big into CrossFit. Anything interesting to add in terms of your personal uses of the newbie and different applications? But I don't know if there's any interesting tidbits to add there.
One caveat, which is a little bit different, is I actually have endometriosis, and I really like the newbie for endometriosis, and it's actually really helped with my pain and kind of being able to kind of help support and just kind of change a little bit of the neurology that's happening there. So it's kind of a weird benefit that I've actually seen from the newbie, and recommend for people who have endometriosis to try and see if that's a good option for them as well.
Oh wow, thank you for sharing that. That's very interesting. I'm glad it's helping.
Yeah. Well, and one thing I can add on to that as well is, for me, my endometriosis actually attaches to my hip flexors. And so using the newbie to help relax and kind of strengthen the hip flexors is just game changing, as you kind of get that mobility and motion back.
Yeah. And,
Wow.
and for me, so I do CrossFit, and there's been a lot of movements that are challenging within CrossFit, some like bar muscle ups and, dips and all of these things that for me are a challenge because my triceps tend to be underactive. My lats tend to be underactive. I've torn all of the muscles from my neck to my hips in multiple car accidents. I've had 9 concussions, so I have pretty bad whiplash. So my cervical muscles, as my chiropractor here would attest to, I have a lot of my own issues. And I do use the newbie as much as I can find time within my schedule to use it. But for my lats, I love it because they are underactive, and they are a muscle group that checked out basically after one of the car accidents I was in. So I've been able to use that to help find more neural control to my lats, helping my traps and my cervical muscles to chill out. I've been able to use the newbie as more of an electrical massage to kind of lengthen those muscles, and then for triceps to build up a lot of the movements that I've needed more tricep strength. So since it helps with activating and kind of building muscle tissue, I've been able to see that personally for sure when I remember to use it. I've also used it. I had diastasis, and so I have also used the newbie machine to heal my own diastasis. So every so often I put it on my core just to kind of keep everything active. But I've seen everyone jokes at my gym because they can tell the days I've used the newbie machine. I kid you not, because every day I use it on my core, I PR. So on some sort of strength movement, like front squat, overhead squat, my cleans, any movement, they'll be like, did you use did you cheat today? Because I literally will get all the activation and be warmed up, and then go and do these movements on my own, and I still benefit from using it. So I use it quite a bit.
That's awesome. I love that it's contributing to those PRs and helping with the PRs and the DR.
Yeah.
That's great. So
Good.
as we wind down here, I want you to be able to point people to your Bump and Beyond website, social channels, and everything. But is there anything more to say? Anything that you would like to give as a final message, or anything that you just feel like, gosh, if we don't go over this, I'll be disappointed later?
Man, I think for us, we do see full family. I think that's one thing we get asked a lot is, even though our name is Bump and Beyond Chiropractic and Wellness, We do see full family. Our passion and our love is definitely for the prenatal, postpartum, and pediatric community. I think that's one, because we've just gone through all these further certifications to be able to support that population so much more. But we do bring in a ton of CrossFitters. I feel like most of my gym does end up coming here, so some big old jack dudes will come in and get worked on by Dr. Lauren, and so we do see full family. So a lot.
We see it all, and not even full family, like athlete specific. We partnered with a couple local gyms, so I'll see just random athletes who don't have other ties. I guess one of the things that maybe specifically chiropractic people don't know is that chiropractic is so beneficial during pregnancy to really reduce not only the pain throughout pregnancy itself, but chiropractic care, especially that Webster technique, can reduce labor by up to 5 hours. And so it can just make it, especially if you're doing a home birth or a vaginal birth, really just so much less pain, but also so much more time efficient, and just makes that whole process smoother.
Wow, that's a big deal.
Yep.
5 fewer hours of labor, and to make it more likely to have better outcomes there. That's huge. So that definitely want to underscore, highlight that, italicize that. That's a big one. Can you also, one of the things that we had touched on a little bit was caring for babies. Can you talk a little bit about that? Because I think to many people that would be a new concept that that one might consider doing chiropractic adjustments with a newborn or a young baby. I mean, can you just speak a little bit about that as one final topic?
Absolutely. So newborn chiropractic is extremely different than adult chiropractic. There's no pops, there's no cracks. So it's not even fully chiropractic in the sense of an adjustment where you're getting that gas release from the joint. The newborns don't have fully developed and formed joint, so that gas can't build up for you to need to be able to do that quick, fast motion. So newborn chiropractic, everything is very light and gentle. It's about the same pressure that you would use to check the ripeness of a tomato. So everything is super gentle. Baby, their skeleton just moves so quickly and so easily. That's all the pressure that you need. But some of the big benefits that you can see for newborn chiropractic is digestive issues, colic, sleep issues, anything musculoskeletal, so like torticollis or tight hip flexors where baby just can't be on their back for more than 10 minutes without crying. And one of the biggest things is colic is actually it's just babies are crying nonstop. And what they found is about 80% of babies born nowadays have some sort of cervical dysfunction with how they're pulled out via C-section by the head and neck, or how they're assisted to come out of the vaginal canal. So they're actually having their neck and head pulled and traction out, which if their head or chin is slightly turned, it can cause some tightness or some dysfunction in the neck itself. And so baby is crying constantly and is just in pain, and that's the only way that they can express it. So we've been able to really help with colic. We've been able to help with latching issues as well. So a lot of different things that we can help with newborns in the office.
Oh, wow. That's amazing. And gosh, if you are the parent of a baby who will not stop crying, and if you're able to help them solve that, that is a big freaking deal. So
we had one patient, their baby was crying, I want to say 8 hours pretty much every day. And after the first visit, we were able to cut it in half. After the second visit, it was down to about 30 minutes. And then after that fourth visit, baby was just only crying when they needed something. So it can make a huge difference. And that's why kind of the prevalence of helmeting has gone up, is just because of that cervical dysfunction. They're only able to look one direction, and so their head just flattens on that one side, and then they need helmeting further down the road. So if you fix it early on, you get them moving both directions, that head stays nice and round, and you don't need helmeting.
I love that. Thank you for sharing that. I'm glad we did get to talk for a few minutes on that too. So yes, really wonderful information. Thank you both. If people are interested in following along with Bump and Beyond, I know on Instagram I follow you, Bump and Beyond Chiro. CHIRO.
Yep.
So that's one channel. Where else, on social media, website, best places to follow along with you and your work?
Yeah, our website is bumpandbeyondchiro.com. So same as our Instagram. We also have a blog that we both write for Bump and Beyond. So we talk about all things chiropractic, newborn, diastasis, exercise, massage, nutrition. So we talk all those on our blog, and we email out, so you can subscribe to our email channels as well. On our Facebook, we also post a lot of groups. We do some meetups at our office for young moms. We do a lot of free activities. We also do about once a month a maternity clothes drive. So since it's such a seasonal time for a lot of moms with their clothes, and maternity clothes are for some reason, so much more money, and you're only going to wear them for like a few months at a time. There's not a lot of options, so we've gone into a cycle with a lot of our moms. Every month we just for free, people will come and drop off maternity clothes. We have a few hours where you can come and get some free maternity clothes, very lightly used, and even if you wear them for a month and want to bring them back, we just kind of keep that cycling available for new moms or soon to be new moms.
Yeah.
That way. So on our Facebook, on our Instagram, and on our website, we keep all of that kind of up to date on all the things that we're doing in our office. So
I love that. I love that clothes drive. That's a great idea. And just what you're doing overall, it's wonderful. Thank you so much. I just want to acknowledge both of you, for the work that you're doing, for serving really an underserved population, and to be able to do it the way that you're doing it. I think it's just incredible. I'm so grateful to have the opportunity to get to know you, to collaborate, and really big thank you for coming on and sharing with everybody listening here, sharing your experience and perspective. And I think, by spreading this message, we're going to be able to collectively help even more people too.
Yeah, for sure.
Yeah. And thank you so much for having us and letting us come and be on your talk.
Awesome. Yes. I look forward to doing more work together with you, Dr. Lauren and Anna, and everybody listening in. Thank you so much. We will see you on the next episode of the Undercurrent podcast.